Well, I use a couple of decision aids on a somewhat regular basis. Probably the one I like the most is statin choice. It already stratifies by patient risk, so the low risk patients and the intermediate risk patients and things like that. What I like about those tools primarily is that they get the numbers in front of the patient. So sometimes I'm not sure whether patients really like decision aids or whether it's the first time they've ever actually seen the numbers associated with the benefits of the medications being discussed. So probably a year ago I had a conversation with a patient who was arguing with her doctor about whether she should take statins, and so they came to me as sort of a neutral second opinion kind of person. And I said, well, let's just look at your numbers. And even before looking at the statin choice decision aid, we looked up her 10-year cardiovascular risk with and without statins. And then we looked at her 10-year cardiovascular risk with and without adequate blood pressure control. And really for her, it made a lot more sense for her to focus on keeping her blood pressure under control than it is to really add a statin. And we could have driven her LDL into the ground and we still wouldn't have really made a dent on her cardiovascular risk. So just getting the numbers in front of the patient is often, to me, the most beneficial thing. And then, of course, you can also talk about values and say to the patient, what's really important to you here? Do you want to get that smidgen of extra benefit from taking the medication or not? So that's probably just one example that I would use from using decision aids.